Thank you very much. Yeah, afternoon, everyone, and thank you for inviting me to speak today. So I'm Jane Lyons. I'm a research officer and data scientist based at Swansea University, and I'm the social justice research lead for administrative data research Wales. So today I'm going to be presenting on a piece of work we have recently published under the social justice theme, as well as quickly just introduce the work we are planning to do under this theme. So I previously worked with HDR UK on the multi-morbidity work programmes from the first round of funding, and I still work closely with HDR UK colleagues, but I now work on ADR Wales and UK. So their successful research bid has seen £17 million being awarded to ADR Wales, and ADR Wales basically links specialist teams in Welsh Government with researchers and data scientists with the aims of delivering research programmes to support priority areas for the Welsh Government programme of government. So this grant covers the period of 2022 to 2026 and supports funding of 12 researchers across 10 theme areas. One of those areas is the social justice theme that I've been funded to work on. And so the overall aim for us is to harness the potential of routine collected administrative data to produce evidence that will shape future policy decisions and help build a healthier, more equal and climate resilient Wales. So under this theme, our research will focus on linking anonymised individual level, population scale, demographic, health, environmental and social data held in the SAIL data bank, with additional newly acquired administrative data to answer research questions on inequalities in health, education and occupational outcomes for the population of Wales. To answer the research priority areas stated here, we will use SAIL data sets such as the Welsh Demographic Service, GP data, hospital admissions, outpatients, A&E data and education data. And we also plan to acquire new data sets such as the 2021 census data to create a population matrix and define new population characteristics to ensure different groups of vulnerable and marginalised individuals are represented. We'll also acquire things like housing support data to explore the impact of the cost of living crisis, Department of Work and Pensions data to categorise individuals by household income and benefit status, and also healthcare worker data sets to kind of measure inequalities in career progression in our healthcare workers. And so inequalities will be measured by examining disproportionate outcomes between different groups of people in Wales. So I mentioned we use the SAIL data bank for our research, and for anyone who doesn't know what SAIL is, SAIL stands for the Secure Anonymised Information Linkage Data Bank. It's a remotely accessible, trusted research environment. SAIL contains billions of linked anonymised person-based records from primary, secondary and tertiary sources, and receives extracts from all inpatient stays, outpatient appointments, emergency department attendances, critical care stays across Wales, and also 86% of Welsh GP practices. There's also other numerous data feeds such as our educational attainment for children, our ONS births and deaths registers, the cancer register for Wales, as well as 100 project-specific data sets that come in just purely for one or two projects. So moving on to a recent piece of work, which was a collaboration between Swansea University, but also colleagues across HDR UK sites. In this study, our aim was to measure chronic disease accrual and examine the difference in time to individual morbidities, multimorbidity and mortality between socioeconomic groups. For this study, we used the Welsh Multimorbidity E-Cohort, or WMC, which I created back in 2020 whilst working on the HDR UK multimorbidity workstream. And so this cohort contains all individuals living in Wales on the 1st of January 2000 with follow-up until death or residency break, or at the study end, which was the 31st of December 2019. The WMC is still being used by HDR colleagues today for multimorbidity research, but also the e-cohort design for this was pivoted to support the One Wales COVID research response for the population of Wales. So in the study, we use the Calibre disease phenotype register to include 132 chronic disease diagnoses. And this was for both based in primary and secondary care, so we could go into GP and the inpatient data. We excluded individuals who had any of the 132 chronic disease diagnoses between 2000 and 2004 to allow for a 5-year clearance. so that individuals started from a chronic disease-free state, and to capture the first diagnosis from the 1st of January 2005. To measure deprivation, we used the Welsh Index of Multiple Deprivation, the income quintile, at the LSOA level. This study used multi-state models to model the trajectories of chronic disease accrual, but also be able to account for then death as a competing risk. We applied a 4-state model so that all individuals started in a chronic disease-free state, and then individuals could transition to a single chronic morbidity or multimorbidity or death. For this study, we calculated the restricted mean survival time, which represents the average time free from an event, to measure the time spent between health states, and then compared this across socioeconomic groups. And for us, the difference in kind of restricted mean survival time between the socioeconomic groups was used to examine the speed of transitions between states, and subsequently demonstrate the difference in time to develop in a chronic disease or diseases or dying. And this is just an overview of our study population, broken down by the possible model transitions. So in this 4-state model, we had 6 transitions. So you could go chronic disease-free to morbidity, to multimorbidity, or straight to death. And then if you had a morbidity, you could either go to multimorbidity or death. And then from multimorbidity, you could just go to death. That was the absorbent state. And obviously, you could just remain healthy for the whole study period as well. And so in this table and in this study, we had 965,905 individuals included. And then we've just broken it down by deprivation, age, and sex for each transition group there. So here I'm just showing you the 70-year-old results. We ran the model every 10 years. So for 10-year-olds, 20-year-olds, 30, 40, 50, 60 to 70-year-olds. The trajectory column just shows the 6 possible transitions that I mentioned between the states. And then we've got this restricted mean survival time for individuals living in the most deprived areas of Wales, down to the least deprived areas of Wales. And then with the final column showing the differences in time between the most and least deprived areas of Wales. And because it's restricted mean survival time, we obviously did follow from 2005 up to 2019. So there's a max of 15 years that it could be followed up for. As shown here in the final column, but actually for all age groups, individuals living in the most deprived areas consistently experienced accelerated time to diagnosis of chronic disease and death compared to their demographic equivalent living in the least deprived areas. And this demonstrates a premature aging, subsequent poor and reduced quality of life in our residents living in the most deprived areas of Wales. So just for an example, I'll show you the bottom row where we've got multimorbidity going to death. There's a difference in 2 years of survival between a 70-year-old man living in the most deprived area of Wales compared to a 70-year-old male living in the least deprived areas of Wales. This is just some data visualization from the study. The figure on the top row shows the cumulative incidence of multimorbidity for 10, 40, and 70-year-old females by deprivation quintiles. And the bottom row shows the cumulative incidence of mortality for 10, 40, and 70-year-old females by deprivation quintiles as well. And so, as you can see over time for the study, there's a steepening of the gradient, in particular for the mortality, when you're comparing individuals living in the least deprived area up to the most deprived area. And for here, you can see the different transitions as well. So we've got blue is healthy to death, orange is morbidity to death, and red is multimorbidity to death. And then this figure here are just mirror plots. So they demonstrate basically the time spent in each state. So again, here we've just shown the 10-year-olds, the 40-year-olds, and the 70-year-olds. We've got the females in the top row and the males on the bottom row. And as you can see, individuals living in the most deprived areas spend the least amount of time in the healthy or chronic disease-free state. and subsequently spend more time in the chronic disease and death states. And obviously it's enhanced as the older you get. Obviously we've got a lot less 10-year-olds dying, so you can't really see as much of the death state in the left mirror plots. So yeah, and then for further work, so for this analysis, we adjusted our models by age, sex, and area level deprivation. However, as part of my role, we're trying to improve our ability to categorize the population of Wales by new individual and household measures. So as I mentioned previously, we're hoping to work with the Census 2021 data to incorporate ethnicity and other descriptors, particularly protective characteristics in the data. So to be able to do that, to incorporate that, but also we're kind of incorporating housing data as well, to be able to characterize poverty and look at individuals and households that are struggling to pay bills. So individuals who are in council tax debt or at risk of losing their home. And then the Department of Works and Pension data would be able to look at kind of income status, anyone on benefit status, disability status, and VOA, so any kind of housing data that we can then incorporate into our models. But yeah, this model was run without ethnicity, but we will be incorporating that into future models going forward. Not sure how much time I've got left, so I'll just leave it there, but thank you very much.